everyone, Namaskar. I'm Dr. Ishant Mandavaya. I'm currently working at Indira Gandhi Medical College, Shimla. And today we are going to speak a little bit about latest update in hypertension. So, as we all know that hypertension is one of the leading causes of death in India and in worldwide when it comes to non-communicable disease. And one of the major reasons in our country for this is that there is the pretty lack of awareness among people, among society, that what is hypertension, how to get the treatment, how we can get the treatment, where we can get the treatment. So this lack of awareness is one of the reason, and another is that poorly this hypertension is remains poorly controlled because of primary care and poor follow up through the patients to the primary health centers and to the healthcare providers. So let's talk a little bit about the latest updates. What are the updates we are having in hypertension nowadays? So most importantly, the age group which hypertension affects most is between 40 years to 69 years of age. Most commonly, it's going to affect those people. And next, there are few societies, like one is International Society of Hypertension, second is American Heart Association and American College of Cardiology, and then there is WHO, of course. So I'm going to point out some of the important updates recently, like in 2020, Global Hypertension Practice Guidelines by International Society of Hypertension suggest there should be minimal optimal care to the patients, even in the poor resource setting of the country or of the health system. Like if there are very poor resources we have for the treatment, at least there should be awareness to the people about the hypertension. Also, there is a study by American Heart Association and American College of Cardiology. They released a statement in 2021 offering a new guidance for stage 1 hypertension. Just suppose a patient is coming to you with stage 1 hypertension, and there is no previous risk of atherosclerotic cardiovascular event associated with the patient in last 5 to 10 years. Then we don't have to use any drug, any pharmacological therapy is not required in such patient of stage 1 hypertension. We can just tell the patient to modify his lifestyle, to improve his diets and all that, and we don't need any pharmacological therapy. Another thing is that during this COVID era, as we all know that the whole world hit with the COVID-19 pandemic situation, then most oftenly we have seen that there are severity of acute respiratory distress syndrome. So one study conducted by American Association suggested that if we use metoprolol in such patients of COVID-19, it helps in decreasing lung inflammation, which further reduces the risk of acute respiratory distress syndrome. So that is also of, very much important. Another thing I would like to share is that when it comes to monitoring of the blood pressure, we all know that we monitor the blood pressure, but we have to be very careful when we monitor the blood pressure. It's not just in the office, but also out of the office we have to monitor. During night time, we have to monitor the blood pressure. And one study shows the very much importance of the nighttime blood pressure. If there is an increment in the systolic blood pressure by 20 mmHg and in diastole by 10 mmHg, it will increase the risk of cardiovascular disease by 23%, and the risk of mortality further will be increased by 36%. So this is of very much importance to monitor the blood pressure, and when to monitor, how to monitor, and we have to be careful that we have to monitor 24 hours can be there. Night monitoring of blood pressure can be there. So next I would like to talk about therapy. Yeah, if we have to start the pharmacological therapy, the European Society for Hypertension has given the guidelines that if we have to start the pharmacological therapy in context of lowering the blood pressure, we have to start with the dual combination of it can be either ACE inhibitors or ARBs with the combination of calcium channel blockers or diuretics. Anyone can be used. So this is how we are going to start the treatment. Another thing is that recently, just few months back, there was a product called valsartan, and whole of the world has recalled the valsartan as there was a carcinogen detected in that, which was causing liver cancer. So we have to be very updated in such regard that we are using some drugs and then there is a ban on that drug. We have to stop using such drugs, and we have to be very careful about such things. So these are the few points I wanted to discuss with you, and thank you so very much.